I'm Dr. Scott Mahanty, a board-certified musculoskeletal radiologist, and I want to share with you my journey at Charlotte Radiology as we become part of U.S. Radiology Specialists, because I think it will provide insight into what it's like to be part of a practice affiliated with U.S. Radiology. Like most of my peers, when I was training in residency at UCSF and my fellowship at NYU, I considered many career paths, including 1, academics, and 2, private practice radiology. I like the allure of joining a top radiology group with strong hospital relations, and I really want to be part of a clinical decision-making team, as well as have the opportunity to read and perform high-end diagnostics and procedures. I was really excited to go on the partnership path to lay down long-term roots for my career. I considered a number of different practices across the country, but ultimately I chose this practice because I love the community, its growth potential, and importantly, respected the physicians of the practice. Well, what I was not expecting was to be part of a private equity-owned group. In residency and fellowship, you hear a lot of negative perceptions of corporate medicine. And based on those impressions, it seemed like something I would try to avoid. I would never want business interests telling me how to practice medicine or treat patients, and I've had friends and colleagues in residency who have actually had negative experiences with some of the models that are out there. So, when I heard our practice was going to join U.S. Radiology not long after I had joined, I had a lot of questions. And the more I dug in and talked to the partners in our group, the more I came to understand that the U.S. Radiology model really is different than most of what's out there. I continued to be on a partnership track with my local practice, not U.S. Radiology. And that was really important to me. I wanted to have a local identity. And within our local area, as a patient or a referring physician, you really wouldn't know that U.S. Radiology was involved. I'm now a partner in my practice, and I take a lot of pride in that. Really, it hasn't changed my day-to-day job or how I'm treated. I was surprised to hear that all U.S. radiology practices are guaranteed local clinical autonomy in perpetuity. What that means is that nobody at U.S. Radiology can tell us how to practice, how many hours to work, who we can hire. All of those decisions are made locally by our clinical governance board, which is made up of our local physicians, of which now I'm a member. So, I can tell you firsthand, we're calling the shots when it comes to clinical decision making. And that's guaranteed. Even if U.S. Radiology takes on future partners, nobody in a corporate office will ever have the influence in how we make our clinical decisions. The perception of private equity is salaries go down and workloads go up. But that hasn't been the case for us. It's actually been the opposite, and I've been able to benefit from those salary increases. Again, we determine how much work we take on and how we staff it. And this includes only taking on contracts that make sense for our practice. My local group sets my annual salary, and all quarterly true-ups are based on actual local performance. Overall, salaries have continued to increase over time as improvements from expertise in non-clinical areas like revenue cycle management and managed care contracting allow us to keep more of what we earn without working any harder. U.S. Radiology also has a big commitment to owning and operating outpatient imaging centers. And since our practice has a significant outpatient footprint, the improvements we've seen in the operations of those centers has generated more passive technical income for our practice. So, the negative perceptions of private equity I had haven't been a reality with U.S. Radiology. I've been here for over 5 years now, and on a day-to-day basis, I don't practice radiology any differently than my colleagues at other independent radiology groups. But I've actually seen some important benefits of having the support of U.S. Radiology behind us. It's great to be part of a national practice with musculoskeletal colleagues to consult with across the country. I attended the U.S. Radiology National Physicians Summit, and it was an amazing chance to interact with colleagues, hear national thought leaders on leadership development and physician burnout, and a highlight was actually a subspecialty lunch breakout with other MSK rads from across the country. We also have a National Physician Leadership Board that includes several of my local colleagues, as well as members of each U.S. Radiology practice. And that group focuses on clinical quality initiatives across the U.S. Radiology network. Again, this is completely physician-led. I like the idea that in addition to being a partner with my local practice, I'm also an equity holder in U.S. Radiology. My salary is still determined by how we perform here locally, but I like that I have an additional financial upside as the company continues to grow and succeed. That's really exciting for my long-term financial security. I'd say that each radiologist needs to make their own decision about which type of practice is going to be the best fit for them. There are a lot of variables out there. Location, size of the group, partnership structure. My only advice would be, if you're considering a practice affiliated with U.S. Radiology, you should keep an open mind. Really, the more you dig in and ask questions, the more I think you'll find that U.S. Radiology model is truly different. And you can really have the best of both worlds. A private practice partnership track career in a local market backed by the strength of a growing national organization to provide long-term security. It's really been a great choice for me.